performance. Imagine walking into a room and suddenly forgetting why you came there. You pause, smile awkwardly, and tell yourself it's just age. But later that same day, you forget a familiar name, misplace your keys for the third time, performance, or repeat the same story to the same person. A quiet fear creeps in. Is this normal aging, or is something more serious starting? As a family doctor, performance. This is one of the most common and emotionally charged questions older adults and their families bring into my clinic. Memory changes can feel frightening, confusing, and deeply personal, performance. But the truth is far more reassuring and empowering than most people realize. Let me say this clearly from the start: not every memory slip is dementia. In fact, most memory changes after the age of 60 are completely normal and often reversible. The human brain, like every other organ, changes with time. Processing speed slows slightly, recall may take longer, performance, and multitasking becomes more difficult. This does not mean the brain is failing. It means it is aging. Normal age-related memory change usually looks like forgetting names temporarily but remembering them later. Performance. Misplacing items but finding them eventually, or occasionally searching for the right word during conversation. Importantly, these changes do not interfere with daily independence. Early dementia, on the other hand, performance, behaves differently. It is not just about forgetting, it is about losing function. A person may forget recently learned information repeatedly, ask the same questions over and over, struggle to follow familiar routes, performance, or have difficulty managing finances they once handled easily. They may place objects in strange locations, like putting keys in the refrigerator, or have trouble understanding conversations. Performance. Family members often notice personality changes, increased irritability, withdrawal, or poor judgment. These signs are not subtle once they begin affecting daily life. Performance. One of the biggest mistakes I see is people assuming that nothing can be done. That belief is simply wrong. Many conditions that mimic dementia are treatable. Vitamin B12 deficiency, thyroid disorders, depression, poor sleep, performance. Uncontrolled diabetes, infections, medication side effects, hearing loss, and even dehydration can all impair memory. I have seen patients regain sharpness simply by correcting a nutritional deficiency or adjusting medications. Performance. This is why early medical evaluation matters so much. Waiting out of fear only delays help. Another critical truth most people never hear is that the brain remains adaptable well into old age. Neuroplasticity, the brain's ability to form new connections, does not suddenly stop at 60 or 70. It responds to stimulation, movement, nutrition, sleep, and emotional engagement. The brain is like a muscle. What you don't use, you slowly lose. Performance. But what you challenge, you strengthen. Daily mental stimulation is one of the most powerful protective tools. This does not mean endlessly scrolling on a phone or watching television. Performance, passive consumption does little for brain health. What helps is active engagement, reading and then discussing what you read, learning a new skill, practicing a language, playing strategy, base games, writing, performance, or even teaching someone else what you know. All of these activate multiple brain areas at once. Novelty is especially important. The brain loves new challenges because they force it to create fresh neural pathways. Physical movement is just as important as mental exercise, and this often surprises people. Walking, gentle strength training, stretching, or balance exercises increase blood flow to the brain and support the growth of new brain cells. Even 20 to 30 minutes a day can make a measurable difference. Sedentary lifestyles accelerate cognitive decline, performance, while regular movement slows it significantly. The goal is consistency, not intensity. Sleep deserves special attention. Poor sleep is one of the most underestimated causes of memory problems in older adults. During deep sleep, performance, the brain clears toxic waste proteins that are linked to Alzheimer's disease. Fragmented sleep, frequent nighttime awakenings, or excessive daytime naps interfere with this cleaning process. Performance, establishing a regular sleep schedule, limiting caffeine late in the day, getting sunlight exposure in the morning, and keeping the bedroom dark and quiet can dramatically improve brain clarity. Performance. Nutrition also plays a central role. The aging brain requires steady fuel and specific nutrients to function well. Diets rich in vegetables, fruits, healthy fats, legumes, whole grains, fish, and nuts support memory and reduce inflammation. Excess sugar, ultra-processed foods, and chronic overeating strain brain metabolism. Adequate protein intake helps maintain neurotransmitter balance, performance, while omega-3 fatty acids support brain cell membranes. Hydration is equally critical. Mild dehydration alone can cause confusion and poor concentration in seniors. Performance. Social connection may be one of the most powerful yet overlooked protective factors. Loneliness is not just an emotional issue, it is a medical risk. Social isolation increases the risk of cognitive decline, depression, performance, and even early mortality. Conversation, shared laughter, emotional bonding, and feeling needed all stimulate brain activity. Performance. Older adults who stay socially engaged tend to preserve cognitive function far longer than those who withdraw. Let's also talk about hearing and vision, because untreated sensory loss often masquerades as memory decline. When the brain struggles to hear or see clearly, it must work harder just to process input, leaving fewer resources for memory formation. This leads to forgetfulness that is often misinterpreted as cognitive decline. Performance. Correcting hearing or vision issues can result in remarkable mental clarity. From a family doctor's perspective, one of the most important things families can do is observe without panic and act without delay. Performance. If memory changes are gradual, mild, and not interfering with daily function, reassurance, and lifestyle optimization may be all that is needed. But if changes are progressing, affecting independence, performance, or accompanied by confusion, personality changes, or safety concerns, medical evaluation should not be postponed. Early diagnosis allows better planning, better treatment options, and significantly better quality of life. Equally important is how families communicate with older adults experiencing memory changes. Criticism, impatience, or embarrassment only worsen symptoms. Calm reassurance, clear communication, routine, performance, and dignity-centered support help preserve confidence and function. The brain performs better when it feels safe, respected, and supported. I always remind my patients of aging does not mean losing your identity. Performance. Memory is only one part of who you are. Wisdom, emotional insight, life experience, and resilience often grow stronger with age. Protecting brain health is not about chasing perfection. It's about preserving independence, performance, clarity, and dignity for as long as possible. If you take one message from this talk, let it be this: memory changes are not something to ignore, fear, or feel ashamed of. They are signals. Performance. Signals that the brain needs attention, care, and sometimes medical support. With the right steps taken early, many people can slow decline, improve function, and continue living full, meaningful lives well into older age. Stay engaged, stay curious, stay connected. Your brain is listening.